also looking at some stability and in the hospital and if there's a
Yes.
benefit and
So what we're trying to do, in fact, the hospital has got. I'm supposed to be credentialed for that study, and they have yet to send me the packet for the. It's a slow process, Rob. It's a
I
slow
know,
process.
I know.
Okay. But anyway, simple concept. The rate of falls in the hospital is about 1 in 1,000 people.
Okay.
Okay. The rate of falls to injury is probably about 1 in 10,000 of those people. And the rate to falls to injury to death is about 1 in 100,000 people. If you wanted to map it all out.
Right, right, right.
But that is that 10,000 people per year die as a result of a fall in a hospital. That's not just a fall at home.
Could you
That's
ask
in a hospital.
text?
10,000 people a year, that's a lot.
Yeah.
So if you could improve the rate of fall even by just 10%, you'd save 1,000 lives per year for something as stupid as $1.50 a day band-aid. Really? Okay. So to me it seems like that is a huge
Opportunity.
that would be that's a huge opportunity. And hopefully we'll get that study underway pretty quick. So it's like going through all the hospital committee stuff and all that kind of beeswax and getting the internists on board for all these sort of things. And if that study goes well, then we'll need our friendly neighborhood distributor. You might know somebody like that who could then stock all the hospitals in America with these little band-aids. I mean, honestly, it's too easy to spend an extra $2 per day on a patient to improve their survival rate of the hospital stay. You know, and what I truly would like to also see, although it's not in this study, would be a post-operative study using pain patch, peace patch for anxiety, sleep patch for sleep, and this Liberty patch for balance. Because after surgery, I take a hurting patient in a dark room, tethered to all kinds of crap,
Right.
including STDs, so they don't get a blood clot. And the defend patch actually can keep you from getting a blood clot, believe it or not. So you start slapping some of these patches on a person, you can maybe untether them from some of this technology that they're tethered to. Number one. Number two, they won't be sedated. They can get up and go to the bathroom on their own without the Ambien on board or
Sure.
the fentanyl on board or whatever the case may be, or the anxiety medicines. So you really can clean up the post-operative period if you didn't have to use those other medications.
Have
So I would love to see that study, but you got to baby step your way into that.
yeah. Have you dove into or like any of your patients or any feedback from your patients with any of these patches?
Yes. So yeah, the pain patch. I have a lot of patients who use pain patch after surgery. Some of them will, because it worked after surgery, will use it on a knee or some other issue. They will use the REM patch for sleep. If you're on pain medicine, that actually can interfere with sleep. So a lot of people who take this is one of the reasons I don't write for hydrocodone, but patients on hydrocodone will complain of sleeplessness, and it's because it's interfering with the sleep center in your brain.
Right.
So I don't write for narcotics, and sleeplessness is one of them. Peace patch for the anxiety of being sick and all those kind of things. Defend patch to improve, um, their ability to heal. Don't get a pneumonia while you're in the hospital. The hospital is the number one place to pick up a nosocomial infection.
Right.
We don't want that. So I do educate the patients on this. Some of them think it's hokey and they don't listen to me. And then others actually believe me. So I have quite a few patients on this stuff and I have positive feedback from it. The biggest critic, or I shouldn't say critic, naysayer, would be my husband. So he's like, shit, not gonna work. He will not go to bed without a sleep patch on. He wears that REM patch. He knows it works. So even the biggest
That's
critics,
funny.
you can turn them around because it's not placebo effect. It truly does. It truly does help. The trainer who's helping me get back into shape, little
Yep.
old me and my arthritis, I brought her a pack of the Victory, and I told her, listen, you and her husband's a professional trainer, so she, and so you guys wear these, give them to a couple of clients. Tell me if it wasn't a good workout, if you just didn't seem to have quicker recoveries, better reps, more force, whatnot. So they're sold and are looking forward to adding that to their clients as something that they promote. So it is once you realize the technology is affordable and works without side effects. And in an Olympic event, you can wear it. I mean, there's no drugs.
There
It's
you go.
not
That
an art. It's not an artificial thing. You
if
can
it
train
if
with
it gets
them.
past the
You can,
Olympic committee, that's pretty good.
yeah. Well, it's a band. It's K tape.
Right.
So if you're a doctor, and I know there's a lot of doctors watching what you are putting forward. From a doctor's standpoint, if a patient comes to your office and you have this discussion and you demonstrate how this patch works, you can actually bill a physical therapy code as a result. So, because you're talking about physical therapy, just like a K tape has
Okay.
an application code that is reimbursable by insurance companies, you can do the same. So, doctors can buy these patches at a 50% discount and then bill them as part of office procedures if they care to do so.
Do you carry
Um,
these now in your office if people want them right there, or they can sign up?
I was before I got flushed out, and now I'm in new space.
Okay.
So I am now subleasing in a smaller space. There's no place to kind of keep inventory or staff, but I have a website that they can go to.
Okay.
So the patients will go to that. And then I obviously am not the one demonstrating the physical therapy, so I don't get the code, but there was a time where I was doing that. So that is definitely something that if you're a chiropractor or physical therapist or primary care doctor, gynecologist, urologist, your friendly neighborhood colorectal surgeon, if you're talking about health for patients, if you're about to make an incision on them and you want them to heal, if you follow ERAS protocols, don't want your patients constipated. You don't want your patients, whatever.
Right.
Then start investigating these patches as a means other than medicine to get them through the operative period so you don't dork up their intestinal tract. And like for pelvic floor surgery, which is what you and I've talked about on this channel before,
Right.
you can't. They get diarrhea, they're hosed. They get constipation, they're hosed. I
Right.
mean, like you got to keep these people stable. Let's just face it, they all have anxiety. Okay, they're gonna manage with this peace patch. Okay, I promise. So that's the way that I kind of use it in my practice.
And money back guarantee, right? If they're not
Money
happy.
back guarantee. That's right. And so there's very little to lose if people become affiliates, and you don't have to sell this stuff if you don't want to. There are some people who sell it. Like my trainer is now going to be selling this stuff out of her gym.
Right.
You may not want to sell the stuff, but if you become an affiliate, you get a perpetual 25% off. So a lot of people will become an affiliate with an auto ship. They get 25% off. I'm not suggesting you do that out of the box until you tried it and know that it's going to help you. But a lot of my patients are actually quote unquote affiliates. Some of them are actually starting to sell the stuff, which I found fascinating. But whatever.
Right.
Um, you know, it's a business.
No, that's great. And I think you brought up more and more points of different products that are going to be coming out that will address different modalities. And I think the biggest
Correct.
the biggest take home that I think about in our little discussion is the fact that um, if it's not broken, i.e., in your
You
EEG,
can't have it.
then it's not going to be effective. If it
Correct.
does have some ability to apply some correction to it, then you will actually feel
Correct.
some level of
Yeah.
improvement. So
Right.
that's the beauty of it. It's really a yes or no, and you can kind of find out
Exactly.
what works best for you. And I think they also,
There's zero
if
risk.
you yeah,
Yeah.
if you go to the website,
Mhm.
with Super Patch, and I know we
Mhm.
have our own website,
Link.
which is the
Yep.
Arms Medical Super Patch, and I think you probably have your own.
Yeah.
Also, is that I think they also sell them in fours in some of them.
They used to sell them in fours, and they stopped doing that.
Okay.
And that's only because they expanded to the European Union. So now they're in Canada, they're in America, they're in the UK and the European
Okay.
Union. I think next stop is going to be most likely Australia, New Zealand. So he plans on globalizing the company, and there are some restrictions with other countries what he can and cannot do, and marketing issues, and the cost of putting that in the same little baggie, and blah blah blah. Blah. So in order to keep the cost low, he's sort of got rid of some of those four purrs.
So
So
28 in the package, and to your
20 in
to
the
your point, you got to
package.
figure out, you know, there's
Hmm.
probably enough people in your circle, and this is kind of how I've done it.
Yes.
Is I've dabbled in all the different ones, and I felt like, oh,
Yes.
I don't know, I'm feeling a little bit run down, and I'm sitting on an airplane, and everyone around me is
Depends.
sick, and I'm going, yeah, I'm gonna throw one of these things on.
Yes, exactly. Exactly. So in my house, I've got one of almost every variety. I have an unopened joy, simply because I have no issues whatsoever. But what if we have visitors? I got a hormonal uh, daughter. Yeah, she's 20. Well, she just turned 21. She's growing out of it. I don't know if she'll ever need it, but my son broke up with his girlfriend, right? It's like just a little to get you there.
Right.
If
Oh,
you're not depressed, it's not going to make you super happy. So, but I've got one of everything. That way I know. If I have to take pictures, I'll throw on the Lumi patch. I actually am wondering, since what controls and wearing a Lumi patch actually should be done every day, because good blood flow to your skin every single day will increase collagen.
yeah.
So, I mean, here I am running med spa. I should be wearing that damn thing every single day. That's the one I just
Is that
don't put on.
is
But
that new? Is that a new one, or maybe I
it's
did?
Lumi. It's called an Lumi. It's in a gold. It's in a gold bag. You may not have it.
I may not have it.
You're gonna have to buy one. It's because it's if you wear it for like a photo shoot, you can definitely see a difference within 20 minutes of having it on. You definitely look like you're happy, like the glowing bride kind of phenomenon. That's a blood flow issue. So that's a texture to your skin, going to your brain, increasing your skin blood flow. That's a parasympathetic function. Now, in my professional opinion, the same pathway will be improving blood flow to the intestinal tract because parasympathetic is that rest and digest,
Right.
is that happiness, everything is okay with me pathway. So Illumi every day, not just for collagen, may actually help if you're having gut issues. So, now we got three patches on. I told Jay what he really needs is to get like a watch or a belt or an armband where you can just dial in what you need today digitally and have it tickle your skin. And then no more patches, just get a monthly subscription. You can have whatever sensations you want for X number of dollars. Boom, plug them in and wear a cool watch or something. And so I don't know if he took me up on that, but that would be pretty cool. That's what he needs. Because or underwear. Just
Yeah.
like how
I was
much
just
because
gonna
I need
say, put it
I got
into the
so many patches on.
put it in the band of your underwear, right? Because I always sit there
Yeah.
and go, okay, which
Yeah,
patch do I
I
want to
need like a
throw on
large
today?
swath. Are there a pair of jeans? Those are pretty tight. Can I just have it knitted into a pair of jeans? Because there's so many different pathways that I personally play with. Like there are days where I'm wearing five of these damn things. He's got one for your metabolism. I'm trying to lose weight.
Yep.
He's got one for the metabolism. He's got one for, um, so I do the metabolism. I do the peace. Sometimes I have to wear the pain. Sometimes I'm wearing the REM to sleep. I do the defend. Sometimes I'll wear victory versus liberty, depending on what I'm doing for the day. And that is six.
Now you got peace. Did you name that one already?
Yeah,
That's your
peace. Yes. I mean, like
calm.
I'm running out of hip and thigh room. I've got so many on, but I will not live without the piece. The piece is the one. That's the jam.
Oh,
The piece is the
and you've
jam.
got the focus.
And they got the focus. Yeah, my daughter does peace and focus and has gotten off of all of her ADD medicines. Now, I'm not making the claim that you can come off your ADD medicines. I'm just saying my daughter did. But if you could just come down on some of those
Sure.
medicines, she's on ADD medicines, which made her anxious, and then they had to put her on anxiety medicines, and those two things are fighting each other, and now she's going crazy
Right.
in a
Right.
20-year-old woman. Are you kidding? What, are you trying to kill her? So we took all the medicines away, slapped some patches on her, put her on a clean diet. Much better. Will she still go off the rails on the crazy train like all 20-year-old girls? Of course she will, because she's a 20-year-old girl. But
But
you know, she's like normal and her peers are not. And I attribute that to these patches, clean diet. We took away her social media when we were, now she's 21. I don't have the right to take away her social media, but we made all these interventions a year ago when we still had control over her life.
that's right.
Yes. So, and she's launchable now because of that. So, I mean, I owe this company a lot, but for my daughter, if nothing else.
There you go.
But it's a
And
fascinating.
your husband is sleeping better.
He is. And again, look, when you take a call, he's an anesthesiologist. When you take call, you can't take a sleep medicine.
No.
But you have to work the next day. And you're having anxiety all night long about, am I going to get called? Am I going to miss the phone?
That's right. You
Is the
never
phone gonna
sleep
ring?
well.
No.
You never
You
do.
can't sleep well.
You just
But with one of those REM patches, you can get more quality sleep. You definitely can. So
right. And
he absolutely, especially when he's on call, will wear that. And then you peel it off and you're no longer
right.
sleeping. What the hell?
And
You
if
go
you
back to
need
work.
and
Totally
if you
fine.
need to go in, you just pull it off.
Yes.
And you're not
There's
sitting
no
there going,
CBD in it.
"Oh,
Yes.
I just need it to pass through my system."
Yeah, no. It's so if you travel, if you're a pilot, if you're a cop, a fireman, a doctor, name something where they can't do CBD and they can't. I'm like all the little remedies because you're getting drug tested all the time. You can't, even if you weren't on call, you couldn't do that stuff. So it is helpful for people who have a lot of allergies or they have an addictive personality. They don't want to take something, or they're in a profession where they get tested all the time. So like I don't understand why the military's not wearing one. And it's interesting. I told Jay, I was like, listen, if you could make me peaceful, do you think someone would steal your technology and make people angry and just have an army clad in this material that just makes them angry all the time? He goes, you could. That's why I won't sell my technology. He didn't patent it either.
Well,
No one knows. The only person
right.
who knows how it's made, how it's done, how the sausage is made is Jay Dollywall. That's it.
So he did it like 3M did their post-it notes.
Exactly.
Who
You'll
I
never know.
well I interviewed the gentleman that actually developed it, and
Yes.
I did that for one of my classes in school, and so it was a very
Yeah, cool.
interesting conversation.
Yeah.
Listening how it the post-it note was basically thrown in the trash like 4 or 5
Yeah.
times, literally.
Yes.
Like it didn't make
Yes.
it. People didn't understand it. They didn't really get it. Well, why would you? You're gonna do what with it? And so
Yeah.
that little post-it note of how it
Yes.
started in church, and
Really?
yeah, and so it started in. It They used it. He handed it out to his friends so that they could put all their hymns that they had to sing, 218, 465,
Right.
and right.
Sure.
So you like turn to this, turn to this, turn to this, and then you don't ruin your book, and you don't have to
Yeah.
put paper clips, and you can just put
Yeah.
and so then
No stickies.
that's where it started,
I love it.
that application, uh,
Yeah.
and of course we now see it
Yeah.
where it is
I
today.
got one of those
But
right there. Yeah. Got the first
the reason why no one can develop, or no one does it as well, because you have these knockoffs out there which never stick
Yes.
as well
But they
as
don't stick.
right,
They don't stick. Yep.
is because it's a trade secret,
It is a complete trade
which is what
secret.
Jay
And
did with his, which is
it's a trade
it's,
secret.
it's
And this is interesting. He said, listen, we're going to sell this all over the world. And yes, someone from another country could buy one of these patches and then study the hell out of it. They could even 3D print the entire patch. And if they did that, they would inadvertently, potentially, pick up on the tech. He goes, you can't see it with a microscope. He's the only one who knows. There's a lot of background noise. He's the only one that knows what's background and what isn't, what's working, what's not. But he also puts the technology in the image of his own fingerprints because even China recognizes that they cannot reproduce another person's biometric fingerprint. So for you to completely steal, let's say they were successful, he goes, I don't think they could do it that way. I think the texture is so fine, no one really knows what they're looking for. They'd never be able to tell. But it's in my fingerprint. So if there's ever a knockoff, then he could literally take it to the Hague and take it off the market. So there's no way of stealing it. He'd have to die. So he's like, all right, I got it goes to the grave with him. His kids don't even know how it's made. So he's the only one. No one's telling.
Interesting. Interesting.
It's brilliant to me. Like how did you come up with that many? Not just to get the technology, but to understand how someone was going to steal it from you, and put all of those fail safes into it long before you ever went to market. Like that, this dude is really. I mean, he's like a genius. It's crazy. I would have never thought of that. I would have long given up the ghost, like, oh, this is how I did it, and then just give away my $1 million idea. So I don't know. But anyway, so it's no, he'll never tell, he'll never sell. But the whole point is to turn medicine on its head. And you're right, instead of like, can you not put the warning rail at the cliff as opposed to the ambulance at the bottom of the cliff? Like, you know what I'm saying?
Yeah.
Like,
Yeah.
can we not just do that? That's what the patients want. And even as a physician, you're not going to get rid of my specialty. There's going to be injuries, things are going to happen to you. The human condition gets disease. I don't care who you are.
Right.
So you're not going to get rid of doctors. You'll have less of a need for pharmacy, and that may be that's where all the money is anyway, right? Those are the people that are upset about it. I don't think doctors are upset about it. I wouldn't be,
Yeah.
personally.
And and if you think of, you know, this technology is relatively new. We're going to learn more and more each year that
We're going to
it's
learn more about it. Mhm.
that it's out. We're also going to be better able to determine you know who it aligns better with, right, to have better
Correct.
outcomes.
Correct.
And
And he's improving, like I said, he's improving the deliveries all the time, right?
right,
So, and speaking of 3M, it's 3M that manufactures these little divots. That's why they stick to the skin the way they do. But yeah, he's 18 steps ahead of the crowd. Like he knows where, because he's the one who makes it, he knows which pathways he's nibbling on.
sure,
And every time he comes out with a new patch, I'll ask him and he'll never answer the question. He will, I am making wild guesses when I tell you what pathway each little sticky thing
right,
works
is
on,
right,
only because of the symptom it improves. I'm like, it's gotta be.
right.
He'll never confirm it.
You're
That's why,
you're back tracing,
yes. But he's,
going, all right,
yeah, I'm like trying to retrofit that thing. So, when he says Lumi Patch is for your skin, well, I'm just retrofitting it. It's going to be good for your gut. It may not be. I mean, like the brain may actually have a schism where one goes to the skin, one goes to the gut. I don't know. It certainly would be worth studying.
sure.
And so it's a fascinating